The COVID-19 pandemic served as a stark reminder of the vulnerability of our interconnected world to infectious diseases. It exposed the fragility of our healthcare systems and the speed at which a virus can spread across the globe, disrupting lives and economies. The pandemic also highlighted the disparities in healthcare access and the importance of timely, coordinated responses. Experts agree that another pandemic is not a matter of if, but when. The scientific community has long warned about the potential for new infectious diseases to emerge, driven by factors such as zoonotic spillover, antibiotic resistance, and the ever-increasing human encroachment on natural habitats. The convergence of factors that contribute to pandemic emergence, including globalization, urbanization, and climate change, persists, making future pandemics a near certainty. Global travel and trade facilitate the rapid spread of pathogens, while urbanization leads to crowded living conditions that can accelerate transmission. Climate change, meanwhile, alters ecosystems and can expand the range of disease vectors. This unsettling reality demands a proactive approach to global health security, prioritizing preparedness and international collaboration to mitigate the impact of inevitable future outbreaks. Investing in robust healthcare infrastructure, early warning systems, and research into vaccines and treatments is crucial. The memory of lockdowns, overwhelmed hospitals, and widespread societal disruption remains fresh. These experiences underscore the need for resilient systems that can withstand the pressures of a pandemic and continue to function effectively. We cannot afford to be caught off guard again. The cost of inaction is too high, both in terms of human lives and economic impact. Preparedness plans must be comprehensive and adaptable, ensuring that we can respond swiftly and effectively to any new threat. The lessons learned from COVID-19 must translate into concrete actions to strengthen our defenses against future threats. This includes ongoing training for healthcare workers, public education campaigns, and international cooperation to share knowledge and resources. A failure to do so would have catastrophic consequences, potentially exceeding the devastation witnessed during the COVID-19 pandemic. The stakes are high and the time to act is now. The majority of emerging infectious diseases, including COVID-19, originate in animals. These diseases, known as zoonotic diseases, have been responsible for some of the most devastating pandemics in human history. From the bubonic plague to the Spanish flu, and now COVID-19, the pattern is clear. These zoonotic diseases pose a significant threat to human health, often crossing the species barrier through close contact between animals and humans. In crowded markets and farms, the risk of transmission is particularly high, as animals and humans are in close quarters, facilitating the spread of pathogens. The increasing demand for animal protein, driven by population growth and changing dietary habits, fuels the expansion of animal agriculture. Often, this expansion occurs under poor conditions that facilitate disease transmission. Factory farming, with its high density of animals, creates an environment where diseases can spread rapidly. Deforestation, driven by agricultural expansion and resource extraction, further exacerbates the risk by displacing wildlife and increasing their interactions with humans and livestock. As forests are cleared, animals lose their natural habitats and are forced into closer contact with human populations. This creates a perfect storm for zoonotic spillover, where pathogens can jump from animals to humans, potentially triggering outbreaks with pandemic potential. The close proximity of wildlife, livestock, and humans creates numerous opportunities for diseases to cross species barriers. Addressing these underlying drivers of zoonotic emergence is critical to preventing future pandemics. By promoting conservation efforts, sustainable farming practices, and community health initiatives, we can reduce the risk of zoonotic diseases and protect global health. While predicting the exact nature and timing of the next pandemic remains impossible, experts warn of several pathogens posing significant risks. High on the list are respiratory viruses, notorious for their ease of transmission through respiratory droplets and aerosols. Influenza viruses, with their propensity for genetic mutations, constantly pose a threat, with new strains emerging regularly. Another concern is the H5N1 avian influenza virus, which has demonstrated its ability to infect humans, albeit with limited human-to-human transmission. The recent spread of H5N1 among mammals, including mink and sea lions, raises concerns about its pandemic potential should it acquire the ability to spread efficiently between humans. The COVID-19 pandemic exposed critical weaknesses in global health systems and pandemic preparedness. Many countries were ill-equipped to handle the surge in cases, leading to overwhelmed hospitals, shortages of essential medical supplies, and a devastating loss of life. The pandemic also highlighted the importance of robust public health infrastructure, including testing capacity, contact tracing, and effective communication channels. Furthermore, the pandemic revealed deep-seated inequalities in access to healthcare and vaccination, both within and between countries. These disparities exacerbated the impact of the pandemic, disproportionately affecting marginalized communities in low-income countries. Addressing these systemic issues is crucial for building more equitable and resilient health systems. Despite the hard lessons learned from COVID-19, significant challenges hinder global efforts to prepare for future pandemics. The pandemic revealed glaring weaknesses in our health systems and the need for robust preparedness plans. However, addressing these issues is easier said than done. One persistent issue is the lack of sustained political will and funding for pandemic preparedness. Governments often shift their focus to other pressing issues once the immediate threat of a pandemic subsides, leading to a cycle of neglect and underfunding. The urgency felt during the crisis often wanes as the immediate threat recedes, leading to complacency and underinvestment in critical areas like surveillance, research, and public health infrastructure. This lack of continuous investment leaves us vulnerable to future outbreaks, as essential resources and infrastructure are not maintained or improved. Another challenge is the lack of global cooperation and coordination. Effective pandemic preparedness requires a unified global response, but geopolitical tensions and national interests often hinder collaborative efforts. The COVID-19 pandemic exposed the limitations of a fragmented global health architecture, with countries often prioritizing their own interests over collective action. This fragmentation leads to inefficiencies and delays in responding to global health threats. This self-interest manifested in vaccine nationalism, with wealthy nations hoarding vaccine doses, leaving low-income countries struggling to access life-saving vaccines. The unequal distribution of vaccines not only prolongs the pandemic but also exacerbates global health inequalities, highlighting the need for a more equitable approach to pandemic preparedness. Despite the challenges, the COVID-19 pandemic also spurred some positive developments in global health. One significant advancement is the development and deployment of mRNA vaccines at an unprecedented speed. This breakthrough technology holds promise not only for future pandemic response, but also for combating other infectious diseases and potentially even chronic conditions. Another positive outcome is the increased investment in disease surveillance and early warning systems. The pandemic highlighted the importance of real-time monitoring of potential threats, prompting efforts to strengthen surveillance networks, improve data sharing, and develop new technologies for rapid pathogen detection. To effectively prepare for future pandemics, a multi-pronged approach is required, encompassing strengthened surveillance, robust public health infrastructure, and sustained political commitment. Investing in research and development of new vaccines, therapies, and diagnostic tools is crucial to stay ahead of evolving threats. Equally important is addressing the underlying drivers of pandemic emergence, such as deforestation, wildlife trade, and intensive animal agriculture. By tackling these root causes, we can reduce the risk of zoonotic spillover and prevent outbreaks from escalating into pandemics. Public trust is paramount in responding effectively to pandemics. Clear, accurate, and timely communication from public health officials and government leaders is essential to build and maintain this trust. Transparency about scientific uncertainties, risks, and the rationale behind public health measures is crucial to foster public understanding and compliance with recommendations. Building trust also requires addressing misinformation and disinformation, which can spread rapidly during outbreaks, undermining public health efforts. Social media platforms have a responsibility to combat the spread of harmful falsehoods, while governments and health authorities must proactively communicate accurate information through trusted channels. The threat of future pandemics is a stark reminder of our interconnectedness and shared vulnerability. Addressing this challenge requires global solidarity, cooperation, and a commitment to collective action. We must prioritize investments in pandemic preparedness, strengthen global health governance, and address the underlying drivers of pandemic emergence. Each of us has a role to play in building a safer and healthier future. By supporting global health initiatives, advocating for evidence-based policies, and promoting accurate information, we can contribute to a world better prepared to face the inevitable threat of emerging infectious diseases. The time for complacency is over. The time for action is now.